Hello, I'm Dr. Ken Harper, and I'd like to thank you for visiting Vein Specialists of the South today. It is my privilege and desire to share with you our expertise about vein disease and help you learn how you can achieve healthy legs for life. Vein disease is common, inherited, seen more often in women, aggravated by pregnancy. It is made worse by jobs where you sit or stand a lot. The number one risk for the development of vein disease is genetic. You inherited it. Although we sometimes see patients with vein disease who have no family history, it usually runs in families. Vein disease is more common in women than men. Hormonal changes throughout their lifetime and the effects of pregnancy account for most of these gender differences. There are hormonal changes that increase the risk of development of vein disease with pregnancy begin early on, shortly after conception. There are multiple factors associated with the pregnancy that result in development of venous reflux and the risk for varicose veins. The use of graduated compression hose and leg elevation can counter the effects of the changes of pregnancy. However, even in the best of situations, there can still be an increased risk of development of varicose veins. Most of our patients tell us that they see a few veins with their first pregnancy that disappear within several months. They see a few more with the second pregnancy, and some of them stay. And then with that third pregnancy, they get a lot worse veins, and most of them persist afterwards. It's these patients that have had 3 or more children that have greater than a 60% chance of having significant varicose vein disease. It takes about 12 weeks after delivery for the venous system to return to pre-pregnancy state. And it's at that time that we can do a thorough evaluation to determine what of the damage that occurred with the pregnancy might need to be treated. Careers that require standing or sitting with limited walking increase one's risk for developing varicose veins. We see a lot of teachers, pharmacists, coaches, doctors, factory workers with varicose veins, and it's directly related to their career. If you identify yourself in one of these categories, it would be important to wear support hose when you're working and try to get a chance to elevate your legs periodically throughout the day and when you get home in the evening. Other factors that increase the risk of varicose veins include obesity, trauma, and a history of blood clots.